Hi, I'm Debbie Ingram. I'm the Executive Director of Vermont Interfaith Action, and welcome to our Live at 525 show today. We are a faith-based community organizing federation of more than 70 congregations of different faiths all across the state, and we work together to try to effect systemic change on issues of social justice. So we're calling this show our spring wrap-up because we have been trying to influence legislation that's been going through the General Assembly, and we have also been working on a long-time campaign that had a particular landmark on the first week of May. But joining me today are two of our very active leaders who work hard on some of our issues, and I'll turn it over to them and let them introduce themselves. Beth Ann?
Yes, I'm Beth Ann Mayer. I am a deacon in the Episcopal Church in Montpelier, Christ Episcopal Church.
Great, thanks.
And I am very active with the Housing and Homelessness Organizing Committee of VIA.
Great, thank you. And Frank?
And I'm Frank Sadowski. I'm with Christ Church Presbyterian in Burlington, and I'm on the Racial Justice Organizing Committee for VIA, and I'm also on the board.
Great, thanks so much for joining me today and talking about the issues that you know a lot about. So, Beth Ann, let's start with you with the first topic, which is one that we've been working on for many years, actually, as you mentioned, affordable housing and homelessness. We have a group that has been trying to influence both local and state regulations around both of these things for quite some time. And recently we've been particularly focused on trying to increase the number of units of housing that's affordable to people at low and moderate income levels through construction and rehab, and also trying to ensure that there's emergency shelter, right, for unhoused Vermonters. So could you say a little bit about what we've been trying to do during the biennium with regard to those two issues?
Yes, we have worked on both prongs of action in housing, both shelter and creating more affordable housing, and have done a lot of conversations, research with people in the administration, people in the legislature, people in the non-private sector who are trying to make an impact on housing. And we're encouraged by the push to create new affordable housing or rehabilitate old housing in a way that it creates safe and livable housing. And I think that the legislature really saw that focus and was able to come up with several ways to impact that over the next several years. Our concern during this year of the biennium was that none of that creation of housing was going to help the roughly 3,000 Vermonters who are currently unhoused and have been for several years now. As you know, we've had a response to put them in hotels, which was a good response for COVID, and very expensive response.
Right.
And the legislature has felt that that is not an expense that can continue forward. But in the meantime, there never, even though there were promises of having a plan to provide shelter that would meet people's needs in a humane and safe and effective way, that plan did not get developed. There was an excellent bill that passed with a wide margin in the House that was a 10-year plan that would have that outcome, that people would be sheltered and moved into housing as it became available, and that did not pass through the Senate. It was never heard in the Senate, which was a big disappointment. So going forward, we felt that we had to be really active about the need for shelter in the present time. Going back a little bit, at the beginning of last summer, close to 400 to 500 people were exited from the hotel programs. And many of those people began living outside. And I'm in the central Vermont area. We had, over the winter, we had easily 40 people living outside all winter. And in Vermont, that's unbelievable. That's unacceptable to us. That just is not how we feel that people should be cared for. So we were very interested in legislation that would provide continuous shelter for people in the hotels. What ultimately happened was that the legislature put an 1,100 room hotel cap on the number of hotel rooms that could be used, and in the wintertime that could go up to 1,300. We are currently using over 1,500 hotel rooms, so that means immediately 400 households have to move out, and the shelters are full. There's no plan for where they will go. The other thing that happened was that they put an 80-day limit on the eligibility, no matter whether you are elderly or whether you have a significant disability or whether you're a family with children. You only get 80 days of shelter outside of the winter months. So the winter months are about 4 months that they are able to come into the hotels. So basically that leaves people with about 5 months of the year when they have no shelter, with no plan. There was some money allocated to creating new emergency shelter. Currently, all of the shelter providers in the state are at capacity. They don't have the administrative or the staff ability to just say, okay, we'll open up 20 new beds. So this is a significant problem that we're still very concerned about. Our neighbors are going to be out on the street. I know people in wheelchairs, people who have a need for oxygen, people who have a need for refrigerated medications to stay alive, and they will not have access to what they need to keep them safe. And so we're very disappointed that Vermont is not going to care for people in this way. Yes,
yeah. Well, and you've touched on so many important aspects of this issue. Just wanted to highlight a couple. The statistics actually point out that Vermont per capita has the second highest unhoused population in the country, which I think people don't realize. And especially with our climate, as you mentioned, it's California is the one that has the highest rate, and California's climate is much different from ours. But this lack, two things that we really were disappointed in, I think, with the state, right, was the lack of any kind of long-term planning, because COVID did reveal that we had more people who were unhoused than we even realized beforehand, right? Because people were couch surfing or sleeping in cars, and they hadn't been counted necessarily before. And then the state did step up and use federal funds, of course, to house, provide emergency shelter, at least in the hotels, as you said. But all along, we knew that we discovered that there were hundreds more people than we thought, and there wasn't a plan, right?
And I think there is kind of the wish or the assumption that people will go back to whatever couches they were sleeping on before COVID. For the most part, those possibilities don't exist anymore. Those households that used to be able to take them in are no longer able to do that. I think that what we had several systems in Vermont that kind of deteriorated at the same time. The elder care system, a lot of our elder care homes closed down over the last 4 or 5 years. leaving a large number of people who are elderly or disabled without a safe place to live. Our nursing homes couldn't find staff, and so they have not been able to accommodate the number of people who need that kind of care. Our mental health systems have not been able to keep up with the demand. Obviously, substance use and is part of the cause of why some people are unable to stay in sustainable housing, and that system hasn't worked well. We have no family shelter system in many parts of the state, and at the same time we've seen rents just go sky high in a way that incomes have not kept up with. So many families have entered homelessness at a higher rate because they can no longer pay the rent that's needed.
Mm-hmm. Yes, yeah. Yeah, so these twin issues of the housing, the construction or rehabilitation of housing that people can actually afford certainly feeds right into the large numbers of unhoused people that we have. So it is a really difficult situation, and the state has been rather unresponsive, right, in many ways. So we were very disappointed. The FY25 budget actually was where a lot of this was tried to work out. And do we know? We were trying to remember exactly what the numbers were, but you pointed out the length of time and the stays.
So
and that sort of thing.
there was a significant amount of money that's been designated to create affordable housing solutions, both through rehab, through manufactured homes, and through multi-unit affordable construction. Affordable housing construction. It's no longer affordable construction.
That's true.
And that more money than we've seen go into that in the past. So that is wonderful. It will not meet the need for housing that we have in this state.
Right, and then as you pointed out, also you can't just construct things or rehab things overnight. It's going to take time, and so we're really caught in this in between time that's really a bind for a lot of people. So, so our listeners are going to be a little bit depressed at hearing about this, because I know we have tried to keep up our spirits and really tried to continue to put pressure on our lawmakers and on the administration, and we have joined together. There are a lot of, the good news, I think, is that there are a lot of organizations, a lot of allies that are working together. We're part of the Housing and Homeless Alliance of Vermont, and that's several good organizations are part of that, and so we'll continue. We'll continue to.
Unfortunately, it's going to fall to towns and municipalities to figure out what they do to care for people.
Right, yes, yeah. So, to be continued, for sure, a very important issue. So, I wanted to move on to another topic that Vermont Interfaith Action has been working on, and the news is a little bit better. We're going to get progressively better, so please keep watching, because we'll end with some really good news. But we've also been supporting the Overdose Prevention Center bill. Vermont Interfaith Action is part of a coalition called Decriminalize Vermont, and that group of organizations stresses a harm reduction approach to substance use disorders rather than an carceral approach. So one thing that we've been really interested in, and our particular groups in VIA that are most interested are the Burlington Clergy Caucus, the downtown congregations, and our Corrections Reform Organizing Committee. And we've been closely following H72, which would set up it would actually only set up one overdose prevention center, only in Burlington, and would use some of the opioid settlement money to pay for this center, $1.1 million to pay for that. And so the good news is that the bill passed both the House and the Senate with large margins, and we do expect the governor to veto the bill. He has indicated that he would several times. And we are hopeful that there are enough votes in both chambers to override his veto. So this is kind of where we are at this moment in time. But there's a lot of evidence. There's some controversy around this concept, but there's a lot of evidence that in the places where this kind of overdose prevention center exists, that it is helpful to people, that it leads them to be able to go into recovery and treatment when they're ready. The idea is to provide a safe place where people who are going to use anyway can go in and they can have their drugs tested to make sure there's no fentanyl interspersed in what they've bought. They are around people who have training who can help them in case they need naloxone or other help, medical help. And one of the reasons that our downtown clergy have been so supportive of this is that many of our campuses of our congregations are places where people gather who do have substance use disorders, and they've been using, and it's heartbreaking for people of faith to come and to see that these folks are in distress, and sometimes they've had to, we've had like staff members, like our administrative assistants or groundskeepers, administering naloxone to folks who are in danger of overdosing, and they aren't trained to do that, and this is not a good situation. So we're really hoping that this will provide an alternative. And there are those who say that we should certainly spend a lot of money on prevention and education, and we agree with that. We should spend money on that too. But we are hopeful that this is a solution, an alternative that will really be a helpful solution to this difficult problem. So that's been moving along. We spent a lot of effort on that, and then there's another topic that we'd like to cover. So Frank has been sitting patiently. We want to include you in the conversation now. Why was the first week of May special in Vermont?
Well, since 2022, the first week in May has been designated by Governor Scott as Inclusion Week, which we pushed for and encouraged, and has been a time where we can really raise up the desire and the goal of being a very inclusive state.
Yeah. Yes. Yeah. It's it's kind of a catchphrase nowadays, but the idea, of course, is to really have select boards and municipalities consider this seriously. What does it mean to provide welcome and belonging to people, right? So, so we're pleased that the governor has made this proclamation time and time again. I know you're part of one of our groups that has been really working on how do we manifest this idea of inclusion. So can you say
Sure.
more about that?
Well, and I think we should talk about there's really a wider group that has been very supportive of this. The program, the effort originally started with 3 guys down in the Rutland area, all over 80, and very much retired, who thought that this was a really important thing to try to push. And it's been amazing kind of to see where it's come from and to be able to celebrate that every year. And again, not us alone, but the state has been supportive, the Vermont Chamber of Commerce, the Vermont League of Cities and Towns, the chair of the Legislative legislature's Social Equity Caucus and the NAACP in the state have all been involved, and they were very much a part of the press conference that we supported, that we put on for that week. I think that's really, I think it's really important to note the number of organizations that are really behind it.
Yes.
In addition to ours.
Yeah, absolutely. And it's interesting because we may come at it from slightly different angles, but we all can agree that it's, we want to create a state where people feel welcome. I know the gentleman from the Vermont Chamber of Commerce, for instance, talked about the trying to attract people to work in jobs, here in Vermont. And he himself is a person of color, and said that he had felt welcome when he came, but he wants to make sure that anybody who considers moving to the state, for work or to set up a business, knows that they are, that there's something concrete that that a town may have adopted that says that they are indeed welcome. So yeah, that's
and I think it opens up. For these towns, and there's over 100, I think it's 145 right now, who have signed on to the declaration. It's really raised their awareness of, and asking the question of what does that mean for each town, or for their town, to be more inclusive. And it's been pretty interesting and very, I think, heartwarming to see towns really step up into what is, for many, is a very new area for them to be thinking about. But towns like Milton had a big diversity festival last year that was a great success, and other towns are doing a wide range of programming across the state. Vermont League of Cities and Towns and the Governor's Office of Racial Equity have been working with towns who've wanted to learn more about what kinds of things they can do, and that's been really great to watch.
Yes, yeah, it's definitely adopting the declaration itself is really the first step.
Right.
But yes, implementation and what does it mean actually in policy and practice to make everyone feel welcome. So yes, we're really glad that the Office of Racial Equity and Vermont League of Cities and Towns is providing some information about that to towns. But it is interesting sometimes to encourage our Vermont communities to really seriously consider this, because I know some of the pushback is actually, maybe not exactly what you would think. It's not that people don't want to be welcoming. They think, well, of course we are welcoming. Why do we need to adopt any kind of statement? Because everybody knows that we're a small town, and neighbors help neighbors, and if I've got more zucchini than I can eat, I'm going to give it to my friends, and I don't have to lock my doors, and all that sort of thing, and so it's kind of interesting. We've witnessed or heard some of those arguments, haven't we?
Yeah, and Vermont's changing, and for all of those stories and the the community and the inclusiveness, which is why we're all here. We still see examples of prejudice, discrimination that kind of regularly pop up through the state, and so often in very surprising places. And so to imagine that we don't have an issue here, that we're not kind of subject to the same prejudices and fears that live across the country is just not reality today, and it's really important that we face that for the future. I mean, not only because it's the right thing to do, but just in terms of needing to bring more people into Vermont and to work in our companies, to be part of the community, to be taxpayers. We've got to be welcoming, really welcoming, because people have choices about where they want to live. There's a lot of good reasons for people to come to Vermont. We need not to have any negatives.
Exactly. Yes. Right. Yeah. Yes. Well, and it's so important to bring up the fact that those of us who are, more privileged, those of us who are white, don't necessarily understand what people of color go through in our towns and our communities. And I know when I was actually served in the legislature, we heard testimony about things that were going on, in our schools, or that people had to face in their work, or looking for housing, or that were stories that were surprising but shocking and terrible also. So we don't know unless we walk in someone else's shoes what they have to go through. So,
and we should really, I think, celebrate, and I'm glad we've had Inclusion Week to do that. The number, we got 145 towns representing something like 78% of the state's population have now signed on to that. And we're working on more. And that's really, to some extent, that's really remarkable that we've had that kind of response. And it's not just been, oh, here's something, and we can easily do this. Select boards and town staff in many towns, I know it's true in my town of South Burlington, have really thought about this and how to really include, make all the programming more inclusive, and really take it very seriously, and which is pretty exciting. And as I said, I think with the help of the Vermont League of Cities and Towns and the Governor's Office of Racial Equity, I think that work will only expand for everybody's benefit.
Definitely, yes, yeah. Yeah, so, well, it strikes me as we've been talking about all these different issues, I want us to say a word or two about the model that VIA uses, or the way that we operate. We are not a single issue, kind of advocacy group. We are an organizing group, which, people, to some people it's sort of a fine distinction, whether we're advocates or activists or organized or, that sort of thing. But in our model, we choose our issues from the grassroots, right, from the ground up, and from doing one-to-ones with people in our congregations and listening to people, and really trying to understand what the issues are that are directly affecting Vermonters. I was wondering if maybe we could close with just you could share a little bit about why you got involved in VIA in the first place, and what was appealing to you about that, kind of listening to other folks.
In churches, I think we're very accustomed to giving direct service. We give meals. Sometimes we're involved in providing shelter. We give money to individuals that may need it. And year after year after year, we don't see anything change in terms of the need. The systems have to change in order to really address why people are still needing that kind of assistance. And so that's why I personally got involved, and why my church got involved, was we were banging our head on the walls. We'd been doing this for decades, and seeing more and more people who needed assistance, and decided to research it and pick an issue and try to have some action that would impact the system.
Yeah, yes, yeah, thank you. Yeah, yes, thanks for bringing up the fact that, a lot of our congregations do a lot of really great work, and it's important, right, to meet immediate needs, but it's also, it can be frustrating, and trying to really address the systems that put people in those situations in the first place is something that we feel called to be a part of as well. Right? Yeah. And Frank,
and I think just to give one example, what in the racial justice group that I'm a part of, we've got 5 or 6 churches represented by different people, and that's because in those churches, people wanted to help, and that issue, the racial justice issue, came up in various different ways. But then where's the outlet? Well, you can gather those folks together under the auspices of VIA and really look at it, as you said, do the research and think about where can we have some impact, collective impact. And so we're doing things in our organizing groups that we couldn't do just as one church. But you know, we've got a common faith, a common belief that we need to be working for the common good, and I think that's VIA has really provided a place where that can happen.
Yeah, great. Thank you so much, both of you, for sharing the work you've been doing with our organization. And for anybody watching at home, if you belong to a community of faith that you think might want to join VIA, please look on our website to get in touch with us, and we'd be happy to walk you through that process. And we also do accept individual members, and you don't have to be a person of faith at all, just a person who agrees with our mission and would like to make some change in our communities. So thanks very much for watching, and we'll see you again next time.